Thank you, Mr. Chair. Welcome, Minister. I think you probably know why I'm here. Milton District Hospital expansion. I'm going to slip through some of this pretty quickly because I've made you aware of these issues in the past. As you know, Milton is the fastest growing community in Canada. The rate of growth is outpacing all previous estimates and projections. During the past 6 years, 60,000 new people have moved to Milton. Another 43,000 will be arriving in the next 5 years. Over the next 2 decades, Milton will become the largest community in Halton region, outpacing Burlington and Oakville. This significant urban community is still served by an 86-bed hospital facility designed and built to serve 30,000 people. Milton District Hospital has not received approval for any added service capacity in the past 25 years. No other hospital in the region, including the new Oakville Hospital, and I emphasize that, including the new Oakville Hospital, is planning to provide core hospital services to Milton residents and its growing population, as there has been an assumption that the Milton Hospital will grow along with its community. Halton Healthcare Services, which runs the Milton Hospital, has clearly and consistently presented a well-thought-out, responsible and credible plan for moving ahead to redevelop and expand Milton District Hospital. We have been and continue to be ready, we being Halton Healthcare Services, have been ready and continue to be ready, willing and able to engage with the Ministry and our local health integration networks on next steps, finalizing the project scope, completing the functional program, and confirming the requirements for interim coping strategies. Our local health integration network has communicated its strong support and its own preparedness to engage in this work immediately. The town of Milton has experienced exponential and unprecedented population growth. Milton District Hospital has inadequate, undersized, outdated physical facilities and aging infrastructure, and has a critical and urgent need to expand its facilities. No other hospital has been or is currently planning to provide any services to the population of Milton, and I can't stress that point enough. Halton Healthcare Services has developed a responsive plan to address expansion of Milton District Hospital and has shared it with the Ministry of Health and Long-Term Care. It has highlighted the urgency of the early start components. It is paramount that our project advances now to begin the next phase of planning. If not, the future needs of the community will be further compromised, and that compromising is putting patient health in danger. Lucy Brun, a partner with Agnew Peckham Healthcare Planning Consultants, noted to the Local Health Integrated Network in the fall of 2009 that over the course of more than 25 years of hospital planning, she has never before been involved in addressing a situation like the one that exists in Milton, noting that's over 25 years of her looking at hospitals. And I quote, in her report, she says, "An urgent and compelling clash of extremely rapid growth being inadequately addressed in a completely exhausted, undersized facility that is totally incapable of meeting contemporary standards and has been waiting for 10 years for expansion," close quote. The Mississauga Halton Lynn Chair, John McGill, in his December 3rd, 2009 letter to the Minister, letter to yourself, quote, "It is critical that the redevelopment of the Milton Hospital be considered a high priority of the Ministry capital planning process. The current facilities are exhausted, outdated, and undersized and cannot accommodate current patient volumes or future hospital service needs. The current Milton Hospital is incapable of supporting modern-day services. It is imperative that this capital request move to the next phase of capital planning." And I underline the words that he has used. These are not weasel words. Critical, high priority, exhausted, outdated, undersized, incapable, imperative. Those are strong words for a chairman of a local health integration network to use. While the Ontario government has provided Halton Healthcare Services with a planning grant, which was submitted in September of 2008, it is yet to authorize the hospital to move forward on the next stages of the capital approval process. Halton Healthcare Services needs, first, support for the proposed Milton District Hospital Master Plan for 2016. Second, approval to proceed immediately with the functional programming for the redevelopment of Milton District Hospital. And thirdly, they need approval to proceed immediately with the planning for the early works project. The early works project being one that, because of the population growth, we won't be able to get to a completed hospital in time to service the needs of the community, and the early works project will be a system of coping strategies to get them through to that completed hospital program. The functional program, which I believe is in the $4 to $5 million area, could move forward immediately without any capital infusion in this fiscal year. The hospital is in a position, because of some frugal planning, that they would be able to move forward with that study and get through till March of 2011 before any funds from the ministry would be needed. Minister, will you move forward with the Milton District Hospital process?
Yeah, thank you very much. And I guess I want to acknowledge that Milton is a very rapidly growing community. There is no question about that. But there's also no question, fastest in Canada. Here's what I think we really need to understand is we came to office in 2003. There was a massive infrastructure deficit. There was not just a massive fiscal deficit, there was a massive infrastructure deficit. The appropriate levels of capital investment had not been made for many, many years, right across the province. So we embarked on Renew Ontario, and Renew Ontario was a 5-year plan. It has seen over 117 major hospital projects underway or complete over the past 5 years. So I think it's important that we all understand that we have made extraordinary, unprecedented, historic investments in capital infrastructure in this province over the past 7 years. That cost us money. And there are some who are critical of us, but it seems that but there is still unmet need for capital infrastructure spending. So we are now looking at what do we need to do next, and we are working very hard on developing a next 10-year infrastructure plan.
When will that be released?
We're working on that now with the Minister of Infrastructure.
I would point out to you, Minister, that in 2003. Milton was embarking on its functional planning stage from a process that started in 2001. The land had been designated. The program was moving forward. If that program had been held to, the Milton Hospital would have been open today. And your government stopped the development of that hospital, and it didn't restart it again until 2007 in Milton's case. So the words that have been passed on by Lucy Braun and also the chair John McGill as to the urgency and the danger that patients are being placed in because of the inadequate service that they can expect from Milton District Hospital is severe. It puts patient life in danger, Minister. And I want you to recognize that fact. And I know you're not going to give me a date as to when you are going to announce this. I hear what you're saying, and with that, I would pass on to the next question.
I would like to finish my answer, if you don't mind, because I think it's important. This is a very important question, and I think it's important to acknowledge where we are in that process. And so we have, as you said, approved a development grant in July. The work has been going on with the hospital, with the LHIN, with the ministry.
July 2007.
July 2007, yes. The LHIN has endorsed the redevelopment of the Milton Hospital site to support increased emergency room, ambulatory care, and related inpatient obstetrical and medical surgical capacity, with the understanding that a robust review and assessment occur at the functional program stage of capital development by Halton Healthcare System and the LHIN on current assumptions and estimates, taking into account population growth, population aging, and the impact of other investments that are being made. I think it's very important that, that people understand that the brand new, yet to be built, but committed, Oakville Trafalgar Hospital is actually located in your riding. And to suggest that your constituents will not benefit from the Oakville Hospital is simply not accurate.
The Oakville, my constituents in Oakville will benefit from it. My constituents in Milton, and I stressed in my question that there is no capacity being built in the hospitals surrounding us. Credit Valley is not far from us. Burlington Hospital is not far from us. But there's no capacity in those hospitals for Milton residents. Each community in Halton, through the Halton Mississauga LHIN, is expected to develop their own capacity. That was a principle that was put down by your government, and it was it's been adhered to. The Oakville Hospital is being developed based on the Oakville needs. Let me point out that Milton is the fastest growing community in Canada, but the number of houses that are built in Oakville is just minusculely below the houses that are being built in Milton. All of this growth in Halton is due to places to grow, which was mushroomed because your government shut down the Oak Ridges Moraine and the 80,000 houses that would have been built there. I don't disagree with that decision, other than there could have been some houses built. The whole thing isn't gravel. You could have built some houses in there, but but that has caused the exponential growth in Halton area, which is there's only two things that the provincial government has to live up to in that area. One being highway construction, which is solely lacking, and the second is healthcare, which you have dropped the ball on completely in Milton.
Excuse me, just
Oakville
a second.
Is a different story.
When you were in office, you had no plan. We have a very aggressive plan.
We had already started this hospital.
You guys made lots of promises. You didn't fill them. But what I do want to say is that this is an issue we're taking very seriously. The Oakville Hospital will support your constituents, will provide specialized services.
That's not the mandate that your government gave us.
But if I could just say, what I'm taking from this, and I hope you'll confirm it, is that you will support us when we come forward with a budget that includes more infrastructure development. Because you can't say, only in my riding will I support infrastructure. You got to support infrastructure across the province. You're getting a brand new hospital in your riding. That's something that we're going to have to pay for, and we're going to need your help to do that.